is my absolute pleasure for us to begin this incredibly important conversation on symptoms and side effects. As you all come in, I do want to let everyone know that in the sickle cell classroom at sicklecellconvention.org, there is a place, if you scroll down, there's a classroom there. And inside of the citizen scientist portion of the classroom, we have divided the education out by body systems. And those educational videos, they tell you a lot about all of, there it is on the screen. They'll tell you quite a bit about what's going on in the different symptoms and side effects that can occur in sickle cell disease, how it affects different parts of our body systems. So if you were to visit that, you will have lots of educational information that you can watch all of those videos scrolling through your screen that was there just now. Wanted to share that with you. Hope you all have gotten an opportunity to watch most of those already. They've been up for a couple weeks now, and we hope that you've had a chance to review them leading into this, because today, the goal of this is a conversation. We are going to have a conversation about the way sickle cell can affect different parts of our body. We have with us, you all have heard from her once already, Dr. Simone Uwan, who is our moderator for this session. She is a medical doctor and she is a warrior.
Yes. Hello, everybody.
We also have with us, joining us, another warrior, Dr. Ramona Lawrence, and she has said she was going to talk to us about her experience with sickle cell and the eyes. And so we're excited to have her with us. We also have joining us Dr. Titi Fasipe, another warrior, and she has a great deal of medical doctor and also is able to talk to us about other things. She's joining us with Dr. Simone as our content expert, and we have our moderator. We're being joined by Elizabeth Kling, Dr. Elizabeth Klings, who has a wealth of information about pulmonary, sickle cell and chronic pulmonary. Santosh Saraf. Did I see Santosh? Are you here?
No.
No, okay. Well, we might not have joining us quite yet. We also have warriors joining us, Shamonica Wiggins, Kadeem Gale, Tavon Ferris, and KW Young. And the point of these are our discussion leaders. And the point of today's conversation is to talk about different ways that sickle cell can affect our body. And we're going to ask questions and get into this discussion. I think it's important that we be open and discuss it. And particularly, how did it affect you? What did affect you? How did it affect you? What did you learn? And what would you do differently or tell other warriors to do in that situation? These are three, I think, important ways to think about the symptoms and side effects that affect those living with sickle cell disease. So now I'm going to turn it over to Dr. Simone Uwan to briefly tell us a little bit about herself, and then we'll go through the discussion leaders. We'll ask them each to tell us a little bit about yourself and a particular symptom or side effect that you're here to share, or an educational piece of knowledge, and then we'll go into the conversation. Thank you, Dr. Simone.
Thank you, and it is an honor to be here. It's an honor to be with you guys. You guys look sharp, and I've been with you all day and just getting tons of pearls along the way. It's an exciting topic for me because, well, first of all, you can see I'm wearing oxygen, so I certainly know about sickle cell and its symptoms and side effects for the lungs. But I've, also had a lot of joint issues. I've had 5 hip surgeries. I've had lots of fun things. I like to call them, just because I want to reframe my life along the way. And I look forward to hearing from you guys what you've learned. As you know, I am a medical doctor with sickle cell disorder. I stopped practicing about 7 years ago and had to redirect my life and what I was going to do because of sickle cell disease and some limitations that I experienced. But I am excited to be an advocate today, to be operating in that space and to be able to hear what you guys have to bring to the table as far as symptoms and side effects of sickle cell disease. So I know that I heard about, I'm not seeing her right now, but the Dr. Ramona that talked about um, effects on the eyes. And I'd love to hear more about that if you could start us out.
Sure, absolutely. I am Ramona Lawrence, and I am a associate professor of community health behavior and education in the College of Public Health at Georgia Southern University. And I am also the director of research for the Sickle Cell Community Consortium. So I am absolutely honored. I am always honored to have this position in both places in sickle cell disease, that I actually understand some very real complications of the disease. And I'm also a researcher and public health professional. And so I am here to talk about the eye, which is something that I very rarely hear about other people talking about in sickle cell disease. And for me, I started to get eye exams from my ophthalmologist a few years ago, and they would put this, run this dye into my arm, and that would allow them to look in the back of my eye and to look at the retina. Well, everything was okay. They started to say, well, we see a little bit of damage where some oxygen may have been lost in your eye, right? And then eventually a month or so ago, they said, uh-oh, you have retinopathy, right? So in my eye. And so what is retinopathy? Retinopathy is like, we have sickle cell disease, and our cells change shape and block vessels in all parts of our body. Well, when that happens in the eye, the same thing happens. It blocks off those vessels in the eye, and it just, it creates issues with that blockage.
Yes.
Well, the eye is a little bit different than the rest of the body because it will start to form other vessels. It's smart. It says, uh-oh, I can't just not have oxygen here. I've got to start forming some stuff, right? And so what happens though is those vessels don't work, right? Because they're not real. They're not the vessels that we were born with. And so they don't work properly, and it causes problems. There's all these abnormal vessels in the eye, and that's what we call retinopathy, right? And so when that happens, it can cause problems with your vision. Eventually it could cause blindness if you don't get it fixed. And so
and how do you fix that? I mean, is there
yeah. So there's two different things that normally happens with retinopathy. One, you can get injections, and the other is a laser. And so back on August 17th, I had the first injection. So with the injection, it sounds really bad. It sounds worse than it actually is, but they stick a needle into your eye. And that injection helps to block the growth of new blood vessels. And so you don't want those new blood vessels to just keep happening in your eye. So they stuck the needle in, and it's super quick. It's a teeny tiny needle, but you need those injections to stop that process from happening.
What would you say is a take home for people in general, like from what you've experienced? Like, what would be your quick take home in terms of eye care?
Yeah, I would say stay on top of getting those eye exams. I would never in life have guessed that I would have retinopathy. One, because retinopathy is really more common in people who have SC or S beta plus thal, and I have SS. So it does not matter. You have to get your eyes checked, and it's a very silent symptom. I never had floaters in front of my eyes. I never had any kind of sight problem except for just needing glasses. And so it is my biggest advice is absolutely get those eye exams every single time. Go to a eye specialist who specializes in the retina, that's a real ophthalmologist, and make sure that they understand sickle cell disease and what happens with the retina in your eye.
Okay. Well, thank you for that. I think that's definitely a cautionary tale to all of us. My apologies. I did not go around and introduce everyone. So I'd like to be able to do that. In fact, I will ask Dr. Bailey for help if I leave anyone out.
Absolutely.
But I know that there's Dr. Fasipe. Can you tell us a little bit about yourself?
Sorry, I was still pondering Dr. Lawrence's story, and I'm happy
Yes.
she shared that. Yeah, and I was agreeing that very important to see an eye doctor annually. So thank you again for hosting us with this conversation. I think for all of us, our biggest fear is, what is sickle cell going to do next? Or what is sickle cell going to do to me? And I would say I have that fear constantly. As you continue to age, sometimes you get used to certain things. But I will say that mine have happened in these periods of time. Like I'll have periods of drama and then periods of quietness. And so for me, two of the ones I'll share today, because I know there's other examples of complications. One is aplastic crisis. I can discuss that for anybody who has had that or is curious about it. And then the other one relates to bone health and hormones, like female hormones. So I can discuss that a little bit too. But yeah, I'm happy to be part of this conversation today.
Thank you. And then Miss Evanilda, can we hear from you?
Oh, hello everyone. I am so nervous because it's my first time that I stay in one big conference like that. But I am happy too because I can review everybody that I know in Texas and when I stay the first time in this event. And I feel more emotional in this occasion because it's my first time that I stay one conference produced only for families and for warriors.
Yeah.
Because in my country, I'm from Brazil, we have a conference similar, but there are a lot of professionals and many situations in the past, and the conference was developing more for professionals than for patients and the families. That's in opposite way. I believe that is more and interesting because we can dedicate more to hear what the people want to say and what the people desire be care in the health system.
Yes.
And the first time that I find one person with sickle cell, it's because I have one cousin that have sickle cell disease, and my colleague in a school, in the primary school, and many times in the stop the classes because I need to give blood transfusion. But when I was a teenager, I don't understand what is it. And after I engaged in the nursing graduate program, that I studied sickle cell disease a little bit, and I can understand what the girls' feelings. And after that, after I conclude my course, I dedicate my profession to care people with leg ulcers, chronic leg ulcers in general. And what I find in the health system is many people that find us to give dressings in the leg ulcers was very with sickle cell disease person, but don't know because in the program of trial of sickle cell disease in my country, the program, how can I say, the newborn screening started only in 2001. In the old people that birth before it, sometimes in general the people don't know that it's one person with sickle cell. And what's happening, the leg ulcers is like one signal of one complication. It's more difficult, impose more difficult for people, but it's interesting understand that leg ulcers is like one sign of the other complications.
Yes, yes, yes. Well, leg ulcers continue to be a big complication. Let's hear from, thank you so much, by the way.
Thank you.
Let's hear from Miss Shamanica Wiggins. I think we know her, but would love to hear your story.
Hello, hi, Dr. Simone. Thanks for
Hi.
our moderator. Hello, everybody here today. As Dr. Simone said, I'm Shamanica Wiggins. I am an adult living with sickle cell. I have sickle cell SS, and I'm also the social media manager for the Sickle Cell Consortium. I'm currently on medical leave because I'm pregnant. Oh, sorry. Y'all know how it is in the hospital. I'm actually in the hospital because of the pregnancy. I'll be delivering my baby in 1 week, so I'm excited about that. One of the side effects that I would like to talk about, well, it's actually two, but one is strokes. I've had 2 strokes in my lifetime. The most recent one was when I was 30 years old. So it was 2 years ago, and it wasn't an overt stroke. So it wasn't the type where one side of your body is paralyzed or lose function. And some of the symptoms that I experienced the night that it happened made me think, am I having a stroke? But because I was able to do the stroke evaluation, I chalked it up to being tired and went to sleep instead of going to the hospital. So that's like the main thing I wanted to share about today, because strokes can be a silent killer in our community, and people might do what I did and, blow off the symptoms. And I've met people who have had family members who went to sleep and had their stroke in sleep, and they're no longer here with us. So I'm very grateful that I'm still here with everybody and can share my story. And the second symptom that I wanted to talk about is just pain. I deal with pain almost every day, and most of my hospital stays are for pain control. So that's what I wanted to share today, and the symptoms that I would like to give insight on. So I'm excited.
Those are 2 big ones. Those are 2 big ones. Yes, we definitely need to talk about those, come back and talk about those. Let me continue the introductions real quick. So Mr. Kadeem Gale, can you introduce yourself and what you would like to share about?
My name is Kadeem. I'm from Boston, Massachusetts, and I have sickle cell beta 0 thalassemia. So one of the unusual symptoms that I've had is a swollen head. I'm not sure what caused that. The doctors could never give me a reason as to, why my head got swollen. I just woke up with pain in my throat. I went to the ER, and then next thing you know, my head was swollen. I couldn't eat. They gave me like sponges to like dehydrate myself because I couldn't like really drink either. But I had IV. And that was my first experience having Demerol. I think it lasted maybe 5 to 7 days, and then they said that because I'm not eating, they're gonna have to give me a feeding tube, but that never happened because I was discharged before that happened. But my head was still kind of swollen, but it was going down. That was like my first experience, but I've had jaw pain, and that's very unusual. My first time having jaw pain was probably 2018. I was in New Jersey coming home from Boston, and suddenly I was in the airport and I was just inflamed with jaw pain. My lip got numb, never experienced a numb lip. And then that being said, I went to the urgent care. They checked me for like, strokes and whatever. And then they said to follow up with my dentist because anything that happens in your jaw could be like something wrong with your tooth. And I went to see my dentist. He said that everything was fine, but then he said I should consult with the oral surgeon. And the oral surgeon was able to tell me that I had my numb lip was because of, just dental works over the years. When they inject you with the Novocaine, I think he said that it affects, because you have sickle cell, it affects your jaw. And now that I'm getting older, that I'm probably going to experience more numb lip. And I've had I've only had like a numb lip when I'm in like very severe crisis. Not all the time my lips gets numb, and it lasts for like 3 months. It lasts for a long time.
Yeah.
And
I've actually heard of other people having numbness in the face and the jaw and lips. It's very interesting. Yeah, let's come back to that as well. I mean, it's wherever blood flows, that's the thing. Wherever blood flows, it can mess with the nerves, it can mess with the tissue, it can mess with the bone. So it's amazing when you think of it physiologically, but scary when you think of it from, the perspective of a patient. I want to introduce Dr. Liz Klings, and I am made to understand that you are the pulmonary person. So I definitely want to hear what you have to say about pulmonary.
Thank you very much, and thank you for having me. I'm Dr. Liz Klings. I am an adult pulmonologist, and I specialize in how sickle cell disease affects the lungs, but I also direct our sickle cell center at Boston University and Boston Medical Center. So I know something about sickle cell disease and how it affects pretty much every part of the body. I will have to say the swollen head story. The swollen head problem, I have not seen a lot in my career. I have had a couple of patients who have had pretty severe pain in their joint, in what I would call the temporomandibular joint, which is right up here, which a lot of people refer to as their jaw. And that may be related to some problems of blood flow to that area, but I don't think my patients who had it ever got to a successful identification of exactly what the issue was, and then a fix of the solution, or a solution. Although over time it did get better. I will tell you, my two patients who had it. But anyway. But I'm happy to sort of talk about anything related to the lungs or sickle cell disease in general. So thank you for having me.
Oh, thank you for being here. And then Mr. or Miss KW Young, I want to see who, I'm not actually seeing on the screen. There we go.
Greetings.
Please introduce yourself. Thank you for being here.
Thanks for having me, Sickle Cell Community Consortium. A lot of the issues that were tabled a while ago, I have experienced. So I just want to track back a bit. I'm wearing glasses. I've been wearing glasses since I'm 14 years old. I was blind in one eye for about 5 months, 3 years ago because of retinopathy, if I'm pronouncing it correctly. And the experience with that, you asked for the lessons, the last person you spoke to. So I was diagnosed at probably, I've fortunately lived to my 60s, or my early 60s. I'm saying that to establish that a lot of people still think that we die, yesterday, and we try to ensure that, we build a legacy. And unlike all of you all, I'm only speaking about living with this condition about 7 years now. So I do apologize for being so quiet. A lot of people I've known have passed away, and probably if I'd shared my experiences, they may have been alive, or the parents may have been a lot more comfortable taking care of them. So to the eyes issue. So I was diagnosed and treated with laser, as the last person mentioned. And for about 30 years, I followed a couple of things. I no longer exercise extensively because I understood building pressure in your head could increase pressure in your eyes. You can have a bleed, you can go blind. That's all I needed to know. I didn't need to know medical terms or anything like that. But I saw a doctor. I had a bleed, and I went to the emergency room. I was actually overseas. I'm in Trinidad and Tobago in the Caribbean presently. I was in the US, and by the time I got there, they saw no evidence for bleed. They transferred me to another hospital to do laser, nothing again. So 10 years hence, so about 4 or 5 years ago, I had a bleed. I knew it was a bleed. I went to the emergency here, and they couldn't see anything. So I went back. I started doing things differently. I was lifting and all, and so on, because a younger doctor told me, there's a reason for all this. That told me that my eyes are fine. I can live life normally. Remember, I was living life very measured previously. My exercise regime changed, or the way I work changed. I wasn't living anything happy. So I went back to all those things. Within 2 years, got a bleed, went, everything cleared up. It bled again after I was doing what I'm not supposed to do. I know that now. When I got there, they said I have a bleed, and I was angry with them because I told them, if you had found it before, blah, 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 then this would not happen. Fast forward to, I was referred to a back of the eye specialist. This time I'm blind about three months now. And he said to me that he can do an operation. Now I've also had something that twists your eyesight. You don't have to live vertically. I don't remember the name of it. But he said when there's a pull on your retina, the membrane, normally everybody's
attachment.
It comes off easily. It's not an attachment, but with us, it is. I was actually ripping a hole in my retina, so I was seeing. And so when I went back to him, I had the bleed. So he said, "Listen, you have two issues now. You have that rip, and you have this bleed. I have to go in and take care of it." And then he went on vacation. Around that time, developed a cataract as well. So I had invasive surgery to replace the lens. I now have a new lens in my left eye. Fix the bleed and minimize the pull on my retina. So from not seeing to seeing about probably 90% now is a blessing.
That's awesome.
I was quietly scared for all those months. Most people who were around me never knew I was blind. It's just one of the things that we have inherited living with sickle cell disease. We are very quiet while we deal with difficult situations.
Suffer, yes.
Good. I think I've had amnesia when I've had severe crisis twice in my life. For there are times I don't remember how the crisis instructed me, and people have now filled me in as to what has happened.
Interesting.
I had meningitis early in life. When I'm about 12 years old, I remember it as well as yesterday because it affects my ear now. I have tinnitus in both ears. And, all this information only came to be since I've been around the community in Trinidad and Tobago. And I want to say that if we accumulate like that, if we gather a lot more regularly, then we'd find that we have a lot more commonalities. So one of the simple
Yes, yes.
is, you know, I had a sense, I had a very active life, and then it started to slow down. I had no reason, no idea why. I used to ask myself, why am I so lazy, blah, blah, blah. And then even Patricia Charles, who is now deceased, so I always talk about her. My first appointment with her, she listened to me, literally complained, and she said, Mr. Young, you're very ungrateful. That's number one. And number two, you need to know that your body is different. Those were the first sage words she made, and that changed my entire outlook on this condition. So I encourage people to talk up. I mean, please do, unlike what I did. Speak.
Yes.
And more importantly, our parents, our brothers, sisters who may not have disease and have the trait, we need to encourage them to test. The trait is probably more significant of a conversation than disease, because without trait, there's no disease. And I just want to quickly go through a list of things that came up. I'm not going to
let me just do this real quick, Mr.
Sure.
Young. Let me just finish the introductions, and because we definitely will have a robust conversation with all of these interesting symptoms and side effects that we're talking about. But Dr. Santosh Sharath, are you here? Let me see.
I don't think Saraf Santosh has been able to join us.
Okay. And have I covered?
We do have Tavon Ferris. Warrior Tavon Ferris is here.
Okay, great. Hi, Tavon. I see you. Welcome. Can you tell us something about yourself and what you want to contribute to the conversation?
Hi. Good afternoon, everybody.
Good afternoon.
My name is Tavon Ferris. I have sickle cell SC, SS, I'm sorry about that. I want to talk about the side effects of strokes, having slight strokes and seizures. I also want to talk about pain management also, because I feel at times we do get, us as warriors, when we have doctors that doesn't really necessarily know the in-depth of sickle cell, they tend to kind of like rush us out the hospital before actually getting to the root of the problem.
Yes, well, and it's probably, I mean, our pain is multimodal. It's not always about opiates, although that's kind of what they make it about, and then become, and then attack us for not understanding how to treat it. Which I know because I've lived on that side of being a medical doctor and seeing how they talk and how they regard sickle cell patients, which is why I want to bridge that gap. Our pain is not, it's inflammatory pain, right? It's nociceptive pain because you get all that damage that's going on, but it's also inflammatory pain on top of that. It's not instead, it's on top of. And then there's, nerve pain on top of, not instead. So when they're treating, they sometimes just treat with the opiates and then forget to treat nerve pain or to address those things. And so you end up feeling like you're taking more and more opiates, but it's not touching the pain because you have the wrong key for the lock. Right? So, yes. So I think it's a matter of reintroducing them to, hey, there's different types of pain here, and we have different types of destruction and interruptions going on. So could we address all of them so that we could actually, get better quicker and possibly use less narcotics because you're using the wrong lock. So,
I totally agree.
Yes. So
is there
anybody else that I left out? Dr. Bailey, as far as I only see a limit, those people that I called out on the list of presenters, but I didn't. Is there anybody else that I've left out that's a presenter? Let's put it that way, and then you could just jump on it.
No, ma'am, I believe that's all of our discussion leaders that we have
Okay.
today.
All right, so I'd love to hear from the audience, and if you guys have questions regarding any of the body systems. I mean, clearly we had a lot of, I mean, from strokes to, eyes to retinal detachments to, other types of eye problems, wherever blood goes, right? Wherever blood goes, jaw numbness, head swelling. Kadeem, you're definitely on the less talked about symptoms category. But which are you, which can you relate to, and which do you want to hear more about? Please let us know. And while I wait for you to send in your questions, I'm going to go ahead and just ask. I see a lot of people talking about the eye, and so I want to go back to Dr. Ramona and ask if there's anything else that you'd like to add about our care for the eye.
Yeah, I think those are the main things. I don't want people to get confused with an optometrist and an ophthalmologist.
Yes.
Because really, I mean, when you're going to get your eyes checked for glasses, that's an optometrist. And an ophthalmologist is an MD who knows the eye extensively.
Yes.
And so make sure that you are seeing an ophthalmologist, because that person will specialize in the retina and ensure that you don't have any kind of issues that would eventually lead to blindness. And the only other thing that I'll say is some of these things seem scary, but you have to get it checked and it will be okay, right? So when we think about needles in the eyes and lasers and all of that, the thought is bad, but you really, really have to stay on top of these things because you do not want to go blind or have any other kind of issues like that with your eye. And so be brave. We are all here with you, and go and get it checked. Don't not check it because you're afraid of the treatment. That is
yes. No, that's a fantastic point. Is ophthalmology, as simple as it is, people actually think that if they go get their glasses and they get their eyes dilated, that's it. And as people living with sickle cell disease, we're actually supposed to go, from my understanding, is to get a yearly evaluation by your ophthalmologist. Not by the optometrist, by the ophthalmologist. And so, yeah, I appreciate that point. I think a lot of times it gets missed and lost, and people don't get the care they need. Dr. Fasibe, I'm seeing that people want to know about what you had to say about the aplastic crisis, and also about the hormones that you mentioned. Can you say something about that, about those two?
Sure. I will start with the aplastic crisis. So I will take you to my junior year of college, university. I was doing well, in my opinion. I was already thinking about medical school by that time. And I thought that at the end of the last week, like where we got our exams, there were some leadership conferences that I attended for students. And I just started having this headache that just wouldn't go away. And I was not a person that normally had migraine headaches or headaches in general. But this was a very unusual headache. It was just a thud and it never went away. Most headaches I had were, maybe stress or studying too hard, but they usually would go away. This one, it didn't seem to matter what I did. Wow. It just was there, this pounding. I didn't think of sickle cell initially because it wasn't like a typical pain crisis that I'm used to. So I just kept on thinking, well, I'll wait, I'll get some sleep, I'll get some rest, and all will be well. Days later, I was still having a pounding headache.
Wow.
And I felt myself getting weaker, but I, again, didn't have a pain crisis. So I didn't think about sickle cell initially. I just couldn't understand why I was feeling more and more tired and my head was killing me. I had told my mom, we went to an uncle of mine who's a pastor. They prayed over me. We did all this stuff. And I will tell you, at the time, I thought I was going to die from my sickle cell. Like, I didn't know how to explain how people die from sickle cell. And I thought, well, maybe this is how people die from sickle cell, because this is so weird and I'm just not myself.
Yeah.
So fast forward, and to the point where I couldn't walk again. That's when I was taken to the emergency department. I was completely out of it. When they got me to the emergency room, my hemoglobin was almost undetectable. And my sister said I was out of it. I must have passed out. My sister said my blood was almost like water. It was just so not looking like blood. It was so anemic. So when I came to, I was admitted in the hospital. They had given me about 4 units of blood. And I learned about something called aplastic crisis. And so an aplastic crisis is when, I think some of you have already heard that we have our red blood cells that don't live that long for sickle cell. They live maybe 2 weeks long, sometimes shorter. So we rely on our baby red blood cells, reticulocytes, to replace those cells. But there is a type of infection, and the most famous one is called parvovirus. A parvovirus infection can knock out your baby red blood cells, those reticulocytes, and then you don't have any people to take over the older cells that die. So basically, my hemoglobin was getting lower and lower. The headache was the warning sign. The headache was telling me, my brain was like, hey, you need blood or oxygen. I need some help here. But I didn't understand that that's what sometimes a headache means. I need oxygen. And that's what was happening with the aplastic crisis. And so I had to be admitted in the hospital. I stayed for about a week. And this was all before my 21st birthday.
Oh,
But I'll never forget this. I actually thought again that I was dying because I didn't know what was happening to me. So anytime you feel yourself getting weaker and it's not the classic sickle cell stuff, still go get your labs checked. You don't know whether your hemoglobin is just lower than its normal state. So if you're normally a 7, maybe you've gotten to a 5 or a 4. If you're normally a 9, maybe you're like a 7 or 6. And the headaches and that weakness can be a warning sign. That's what I'll say about aplastic crisis. So again, it's caused by a virus, most commonly parvovirus, sometimes other viruses too. And then on the hormones, well, this one's complicated and I'll try to keep it short, but it's also emotional. So again, I thought I already knew what sickle cell had. I had pain crises, check. I understood aplastic crisis, now check. Fast forward about into my 30s, I was thinking, okay, I want to have children soon. Let me see, let's talk about my risk with genetic counselors, that kind of stuff with my husband. And in order to do part of the counseling, they did baseline labs. And they noticed that my female hormone, something called AMH, and we can type it in the chat. You may have heard this yesterday if you guys were at Dr. Lydia Pecker's session. Dr. Lydia Pecker talked about some of this, and I encourage you guys to watch the Women's Health talk again if you missed it. But I never heard of AMH, but AMH is basically one of the women's fertility hormones. And she noticed that mine was really, really low. She thought it was a mistake. She was like, hey, let's just repeat your labs. When she repeated it, it was still very low. So then she checked my estrogen and other female hormones, and they were all like, then she got an ultrasound to see what's going on with your ovaries. And she saw that one of my ovaries looked like a dud. It just wasn't active at all. And the other one was trying its best. Because I had, and sorry, gentlemen, I had periods, I had menstrual cycles, so I didn't think anything was wrong with my female hormones. But they noticed that one of my ovaries was not active at all. And after they ruled out every other type of disease, they told me this was probably related to sickle cell. You probably had a sickle cell crisis to that ovary that impacted it. Now, I don't want to scare all the women on the team. I'll just say that one of the things you can do is check that AMH level, because Dr. Pecker and people like her have done research, and they found that women with sickle cell are more likely to have a lower level of that hormone earlier than maybe the general population. You kind of get empowered about some of your, reproductive choices earlier on before finding out, maybe if you want to say too late, like me, when I waited, I'm in my 30s, let me talk about having children. I would encourage women, even as early in their young 20s, not that you want to have a baby immediately, but just to make sure you know where your hormones are at.
Those are great
I'll
points.
stop there.
Yeah, no, those are great points. I mean, essentially what you're describing is like a premature ovarian failure.
Yes, exactly.
Young women wouldn't think that would happen, but if you're sickling wherever blood flows, you can end up sickling in your ovaries and creating a scenario where it's not producing the right hormones. It's not producing a lot of things, which can be, if you know what to look for, then it would be very obvious. So I think probably the take-home point is to be able to go into your GYN and say, because of my sickle cell disease, I am at risk for premature ovarian failure. Can you check my hormones, my female hormones? And they have a panel that they would run, so they could pick that up once they knew to do that. It's not something they would routinely do,
exactly.
But if you tell them, then it's, it could be a game changer because they could intervene. Thanks for sharing that. It's amazing the things that happens to our bodies as a result of sickle cell, but it makes sense. Like when you explain it, it makes sense. I wanted to ask, not sure, Ivanilda, if you could talk a little bit more about leg ulcers and what the current treatments, maybe one current treatment, that might be simple enough that people could access, because I know within the sickle cell community, that's a huge deal. I see the questions all the time. They get directed towards me some of the times about treatments for leg ulcers. So can you say something about that?
Okay. And the first point that you need and know it's necessary the person engage in self-care plan. It's because in general leg ulcers emerges after is like one sign of that and no equal or no balance in your health. It's like one sign of the other complications. And what is most necessary that people with sickle cell diseases know, it is necessary adherence. They take pills of and the hydroxyurea, hydration, and the put emollients in your skin, and avoid if you stay in outside in picnics or walking in the forest. It's necessary use the repellent for avoid mosquitoes, and stay with your skin and emollient and hydration will avoid small crack if your skin is dry. And if you know engaged in self-care like that, that will become more vulnerable to develop little ruptures in your skin. And but after you start one little or one small wound, it's necessary to do what's in general the people do. And what is complicated in sickle cell disease is the low oxygen in the peripheral areas, like skin, can produce more easy and the one co-occurrence of infections, for example. And for you avoid it is necessary and clean every day with antiseptic solutions like chlorhexidine, and wash with water and the soap, but put one dress, because if you stay and how can say is out dress, you can drive more the environment of your wound, and that will produce one scar. This scar can and facilitate the infections. It's necessary avoid scars for not facilitate infections.
Okay.
But it's interesting, we have a little time to wait it. And if it, after 2 weeks, the wounds grow or become pure, it's necessary to find one health professional to seek help.
Let me ask, okay, so I think in summary, as I'm hearing and I'm listening carefully, so preventive care, I guess, includes moisturization and a good skin care so that you can prevent cracks and drying of the skin and things like that. And then if you do end up getting something, then you want to use things like chlorhexidine. And I know that when I was training, they would say wet to dry dressings. They always would say, if it's wet, dry it. If it's dry, wet it. Like that was kind of like the theme of dermatology is, you know, so, but for, you know, for sickle cell and skin care, obviously, oxygenation is important, circulation is important. So anything that could enhance those is what I'm hearing you say as well, which is really good. I had a question that I'm seeing from one of the contributors here that says to Dr. Kling, could a skull infarct, I guess because you were talking about this before you went into your the pulmonary part, could a skull infarct cause the acute soft head swelling or crisis? This is actually not a bad question. That's insightful.
I don't know for sure, but I think it probably could. And so I answered it in the chat.
Oh, you did? Okay, I didn't see that. I'm sorry. But actually, again, because it's you can have an infarct anywhere, and then around that would be an inflammatory process, and then you could have swelling and soft tissue. Yeah. I like where I like where our people are going with these questions. Okay, are there any questions I'm missing? Someone was asking about hearing loss. Did anybody have any expertise in that area? In hearing loss?
I have experienced it. I won't say I'm an expert. I've experienced hearing loss because of meningitis.
Because of what? Meningitis.
Meningitis.
I see. Okay.
And wasn't diagnosed. I had to figure it out talking to people in the community about it, and then I realized it was meningitis causing my hearing loss. Okay.
I think there are two people actually that are talking about hearing loss. Well, hearing loss and tinnitus, which is the ringing in the continuous ringing in the ear. And then someone's asking about pulmonary hypertension and acute chest syndrome. So again, Dr. Klings, your department, anything you can mention about that?
Before we move in, I just want to point out that we've only have about 5 minutes to go. We probably should wrap it up in about 3 minutes to give everyone a chance to head on over. I know this is such a great conversation and topic. We could go on indefinitely, and we'll have to revisit it absolutely for sometime soon. But we will need to wrap up in about 3 minutes, Dr. Owen.
Okay, no problem.
So my short answer, because I know we're running short of time, is that I did a lecture on sort of sickle cell disease in the lungs for you that I think is part of the classroom, and it touches on topics of pulmonary hypertension and acute chest syndrome. And I guess the person who asked that, if you have a specific question, I'd be happy to answer it.
Okay. All right, but that was quick. That was definitely good. And yes, someone mentioned that, you know, you can have some of these issues even in the trait. So trait, you know, as we've learned, is more symptomatic than, you know, than previously taught, which is why I always say we really can't have a conversation about sickle cell unless we start talking about the trait and all of these things that people are experiencing. And maybe very quickly, what were the symptoms of Shamanica's stroke?
Okay, I was just typing it. But so with my last stroke, the symptoms that I had, I actually had just got home from a flight. I was doing advocacy in Atlanta. I got home from a flight back to Dallas, and I felt very tired, like extremely tired, more than our usual tired. I felt very lightheaded. It felt like my head was on like a balloon, like a string, and my head was up dangling on a balloon. And along with the lightheadedness, I felt dizzy and I had a headache. But because I did the stroke screen where you can hold your hands out, I was able to hold my hands out. I was able to smile, like do a full smile. So I just said, oh, I must just be tired. I should have did something about it because I had to have my daughter help me to my bedroom to get in the bed because the adults in the house were asleep. I didn't want to wake anybody up because I didn't want to bother anyone because it was a late flight. My daughter stayed up waiting on me. So those were the symptoms. Very tired, extremely lightheaded, dizzy, and a headache. But I ignored it because I could pass or do the stroke screen. When I woke up, I went to sleep. When I woke up the next morning, my head felt horrible. It was the worst headache ever. I just felt horrible. And my family took me straight to the hospital. And the hospital decided to do all of the scans and stuff needed to look for a stroke because it's in my history. And that's when I was told that that I had had the cerebral infarct. I think that's the name of it.
Yeah.
And
I'm so sorry, Shamanica. I have to turn it over to Dr. Bailey, but thank you for that because a lot of people probably would do exactly what you did. So sharing is going to make people a lot more informed to do something better. But Dr. Bailey, I will turn it over to you at this point. Sorry, it's 4:59.
Thank you so much. And it is 4:59. So if we could wrap up and ask everyone to come on into the next conversation. We're so excited that you're here. I know there is so much more. Thank you to each of our panelists that shared your information. And we will try very hard to continue these conversations throughout the year and have more of these important discussions. Thank you, each of you, and I'll see you in the next room.
Awesome. Thank you, guys.